Well, it's 2 o'clock and I don't know if we yet have a quorum. I know that Terry Giardini cannot join us, but we have 5 here, maybe more than 5. Danielle, she signed on, I believe.
Oh, we got
There
some.
are 7.
Oh, perfect. We're set to go then. So I'll call the meeting to order today, August 4th, 2021, the Winnebago County Mental Health Board meeting. And at this time, I'll call roll. Mary Ann Abadi, present. Dick Kunert,
Present.
Dr. Ed Copeland.
Present.
I didn't see you yet, but welcome aboard. Danielle Angelari,
Present.
Dr. Bill Gorski,
Present.
Dr. Terry Giardini, Tim Neighbors,
Present.
Linda Sandquist,
Present.
advisory board members, Wendy Larson Bennett,
Present.
and Jay Ware.
Jay Ware is just now entering the room.
Okay, very good. Welcome, Jay. Is he in yet? Jay?
Yes, no.
Now, very good.
Okay.
I don't see him, but Jay, we're doing roll call.
Oh,
You want to say present, please do. Okay, moving on the agenda. We do have a request or had a request for public comment from Joan Lodge, the administrator for community mental health at Rosecrans. And Joan actually is attending the meeting live with Jason. So Joan, you have 3 minutes and we're happy to hear from you.
Thank you, Marianne. Hopefully everyone can do. Rosecrans is grateful to the citizens of Winnebago County who voted to support raising sales tax to fund mental health services in our area. This has been an extremely difficult year, not just due to a pandemic, due to civil unrest, anxiety, fear, isolation, poverty, depression, and grief of lost lives still due to suicide and opioid overdose. More and more people will need our help and require our help. With these funds, I am confident, and Rosecrans is confident, that we can respond to our community's call for help. Our community believed enough to vote yes. Now it's our time to deliver. I wanted to provide just a brief comment on Rosecrans' Access to Care program. The Winnebago County Mental Health Board funding has allowed Rosecrans to better meet the needs of the community in 3 top priority areas: mental health treatment, case management, and crisis response. As of June 22nd, the Rosecrans Ware Center began extending hours of operation until 8 p.m. Tuesday, Wednesdays, and Thursdays. We anticipate extending these hours starting in September to include Mondays and also on Saturdays. This will allow additional access to care for appointments for access to in-tube services as well as psychiatry. Since June 1st, our co-responder crisis team has provided 321 total interactions, including follow-up to 281 unique individuals. As you recall, that this was a pilot project in November, and we are still in the throes of this and really excited about that. So on behalf of Rosecrans, thank you for the opportunity to better serve our community. Thank you.
Thank you, Joan. We appreciate an update so soon. That's very helpful. And I think that that's, something that the board is looking forward to hearing from other participants that have been funded. So thank you. The next, we have quite a few action items. So I'll start with the first, and that is I'm going to need a motion for the July meeting minutes. So if you have read them and want to put forward a motion, that would be great.
So moved.
Tim, thank you. second,
Second.
and that came from,
Ed Copeland.
well, there you are. Okay, thank you, Ed. So at this time, the motion has, there's been a first and a second. All those in favor, please say aye.
Aye.
Oh, I have to take roll call. How could I forget? So I'm gonna start with Mary Ann Abadi and I, and going on down now, Dick Cooner,
You're on
Yeah.
mute.
you're muted. For the motion, for the minute,
Aye, sorry.
that's okay. That's all right. Dr. Ed Copeland,
Aye.
Danielle Angelari,
Aye.
Dr. Bill Gorski,
Aye.
Dr. Terry Giardini, Tim Neighbors. Tim, did you say aye? I did.
Yes.
Okay.
Aye.
Linda Sandquist.
Aye.
Thank you all. The next action item is the anti-retaliation policy. And at this time, I'm turning the explanation over to Jason.
Well, I will briefly introduce it and then ask our legal counsel, Brandy, if she might have anything to add. But essentially, we were notified by legal counsel that there had been a change to the Public Officials Act that now required there to be a whistleblower anti-retaliation policy for any public board. And so we inquired about options for that. One of the options for that was to have legal counsel develop an actual policy for us, which would also dictate the, I guess, the procedures for investigation should somebody make a complaint against the board, and for harassment or other types of wrongdoing, and that we could actually contract that service to legal counsel as dictated in the policy. So please, Attorney Clemps, correct me if I'm wrong on any of that, or add anything that you feel is necessary.
Yeah, this came out of the Safety Act, the police reform bill, and it requires a unit of local government to have an auditing official, and that auditing official is there for any complaints that for improper government action. And so there's some processes and procedures in the policy as to what would happen with a complaint. And then it requires that there is no retaliation for anyone that is reporting any improper government action.
Okay, and one further clarification. As I understand it, a board member or a committee of the board could actually investigate ourselves if there had been any complaints, retaliation complaints. But we also discussed with you, Brandy, that legally it's that process can be handled by our counsel, and you have agreed to do so, or your firm has agreed to do so. Am I understanding that correctly?
Correct. You can name an auditing official as one of the board members. The issue with that is you guys only consist of a board, so it would be somebody on the board that's being investigated by a member of the board. So we tried to remove it one step and do it at least as legal counsel for any investigations of complaints.
Thank you. And I neglected to introduce you and welcome you. So
That's okay.
I'm doing that now. Any further questions for Brandy? So if I've heard none, so we do need a motion for this anti-retaliation policy. and for our legal counsel to represent us if there were such a complaint.
So moved.
Okay, Dr. Gorski moved it. I need a second. Tim Neighbors. Thank you both. Any further discussion? Hearing none, all those in favor, and I'm going to go through the roll call. Mary Ann Abadi, aye. Dick Kunert,
Aye.
Dr. Ed Copeland,
Aye.
Danielle Angelari,
Aye.
Dr. Bill Gorski,
Aye.
Dr. Terry Giardini, Tim Neighbors,
Yes.
and Linda Sanquist.
Yes.
Okay. Moving down to our third item on the agenda is our FY 2022 work plan. And again, Jason will fill us in. He's
Sure. So
you've
this
seen
was
it.
sent out to everyone last week to give you ample time to review and provide comment. I did meet with multiple board members over the last week and a half. The only changes that were recommended was to add the site visits onto the actual work plan. So those have been added in 2 spots actually to provide different timeframes for when we might do site visits. So we have from October through December, I believe, was the first period of time, and then March through May is the second period of time. I assume that nobody would probably want to do site visits in the thick of winter, so it provides 2 different time frames. For agencies that are ready to do site visits earlier, we can do those in the fall, and those that are still developing and implementing their programs and may not be ready at that point, we can do site visits in the spring. So that was added and formalized in the work plan. And the other item that was formalized in the work plan had to do with a budget item for systems coordination. And so it was recommended by a board member that we, in order to clarify specifically how we will determine how that new budget item for systems coordination would best be allocated, that we actually formalize the development of a systems coordination plan along with the update to the 3-year strategic plan. So in October, as we're updating the strategic plan, we can also identify what the coordinating functions are that we feel the board needs to proactively be involved with as a coordinating body and determine what specific expenses might go with that in order to allocate those funds appropriately. And everything else remains as it was in the original plan.
So again, we'll need a motion and a second to move this forward for a vote. So if anyone chooses at this time to make a motion to approve the FY 2022 work plan, I would appreciate it.
So moved.
Thank you, Dick. And a second.
Second.
Dr. Gorski, thank you very much. Any further discussion, questions, comments?
Tim's got a question, Mary Ann.
Tim,
So this is different from, well, I guess they both go hand in hand, the work plan and the budget. But right now, I didn't remember seeing anything as far as a meeting place for in-person meetings. And, you know, and if we need to put that far as rent in our budget, because as of right now, the governor didn't renew the ordinance allowing us to meet on Zoom. So right now, going forward, we have to meet in person. So we have to come up with a plan on meeting in person for our next meeting, because there's no more, the governor didn't allow, renew the ordinance to allow us to meet on Zoom. So technically this meeting should have been in person, but right now going forward, we have to figure that out.
Tim, so if I may just comment to that because that was also going to be a discussion item today about, well, I had hybrid board meetings, but it sounds like that may not be an option actually. But we do have a conference room that's available at the planning council that's actually a little bit larger than the space that I'm in today that would accommodate the board if you would choose to use that room, and it would allow for a little bit more spacing of people to have seats in between everyone. And it would also be set up for electronic, it's got monitors and things of that nature. There would be no additional cost to that beyond the service fee that's already budgeted. So that's kind of included in the cost of using the planning council services is the space that we have. So I just, again, if you would like to use the space, there's no additional cost for that.
And so, and I could probably share what the county board has done. They had to develop an ordinance so we can do hybrid meetings. But the only way that you can do a hybrid meeting is if there's a family emergency. It was 4 factors that allowed you to meet hybridly, but we could develop our own ordinance. But as of right now, we're supposed to be meeting in person. And I don't know exactly what the criteria is to develop those, the ordinance for the hybrid meeting, but that's something we could look into.
Yeah, I think, Jason, that is something we need to explore, what the conditions are, because I can imagine under certain medical situations that, that would be exclusionary
Right.
criteria from having to show up. But nevertheless, we'll find that out. And Jason had already prearranged for us to have a bigger space at R1, and that, that we were authorized to meet in there if we so choose. So, yes, so we'll look into that, and maybe, Tim, if you could help Jason know exactly what the county board used as in their policy, the hybrid policy for meetings, that would be helpful. It'd be a good start.
Okay.
Okay.
And I'll coordinate with you after the meeting.
Okay.
Yeah, I mean, that's brand new to me. I've not heard that yet. So thank you for bringing that forward. Okay, so any other,
Mary Ann,
yes, Bill.
did you want to defer any other discussion on that till later, or can we continue it now as far as because I know it was a discussion item later.
Okay, what, the hybrid meeting
Yeah,
that you're referring to? Yeah, I mean, it's fine with me to just keep going on this if you feel that, because we have to have a motion to at least approve the work plan. So this is kind of, it's related, but, not necessarily.
Yeah, either way, my only comment was with the current situation out there having really deteriorating, I would hope that we would, if that gubernatorial pronouncement is not renewed based on what happens in the next month, that we would be looking at either CDC guidelines or Winnebago County Health Department relative to wearing masks in a meeting such as that. And I would just, personally endorse that we follow those guidelines, being very careful if we don't have any other choice but to meet in person.
Bill, I concur with you 100% on that. And, I will be in a position where I will need to wear a mask or not attend the meeting due to some recent developments. So, yeah, I hope we can, develop the policy. So, okay.
Jay,
Yeah, Jay, I see Jay raising. Yes.
Yeah, I think I'm in a similar situation. I've got respiratory issues, and matter of fact, I went and got tested for COVID today because I wasn't feeling good yesterday. But I don't know if I'm just paranoid or what, but I know I'm scared of it. So I just want to take that really easy.
Yeah, for good reason.
Couldn't we just agree to a policy that requires when in person, everyone wears a mask? until further.
Do we have the authority to do that? If R1 right now in your building, Jason, are they required, are you required in a meeting such as the size, a meeting room such as the size we'll be in, are people required to wear a mask?
Yes.
Are people required to have a vaccination? Could we ask that? Is that an appropriate question to ask within our board? Are we all vaccinated? Because that makes my decision different.
Well, I did ask that at 2 meetings ago, and one person said that that was a HIPAA violation and was very offended. So obviously that person isn't planning on getting a vaccine. So I can already tell you, we don't have 100% vaccination on the board.
Yeah, as much as I agree, through another circumstance, Marianne, I just want to affirm that unfortunately, Jay, it appears to be protected health information. So nothing prevents anybody from asking, but no one is required to answer the question based on it being personal information.
Right.
I think my own, in addition to Wendy's, which I would fully support Wendy's comment, I think it would be great to know from Tim what the county's exclusions are that allow someone to attend in person, thinking Marianne, you or Jay or whoever may have something going on that even with a mask, I'm not comfortable. So maybe that's the hybrid is through masking, but exclusions for those who rightfully need those.
Yeah, well, we certainly will get some more info on this. But I guess the next meeting, this idea of a hybrid situation set up, that those that can attend should attend in person, I guess. But that's all I can say about that right now. But Jason, I'm sure you can look into this quickly and get back to all of us.
I'll follow up with Tim to see what the county has adopted, and I can also consult our legal counsel on that issue.
Yeah, and remember, technically, part of the reason we're using R1 or able to is we are, strictly speaking, not a government entity. We're a voluntary organization. So I think that changes the rules for us a little bit, but you need to talk to our lawyer.
Okay.
I certainly like the idea of using R1's gracious offer of space without additional cost.
Yeah, that's very generous. Very generous. Okay, so getting back to the action item motion.
So you need a motion. I move that we accept the work plan as outlined by Jason for the next session of our board.
2022.
We had a motion to second already.
Oh, we did that. I'm sorry, I forgot. We got so involved in, our conversation that we got thrown off. So is there any other comment before I call the vote? Hearing none, all those in favor, and again, roll call. Well, Marianne Abadi, aye. Dick Kunert.
Aye.
Dr. Ed Copeland.
Aye.
Danielle Angelari.
Aye.
Dr. Bill Gorski.
Aye.
Dr. Terry Giardini. Tim Neighbors.
Yes.
And Linda Sandquist.
Yes.
All righty. Moving on now to the budget, the 2022 budget. I first of all just want to comment. I want to offer Jason a thank you, a huge thank you, because this is not an easy job, as you all know, to project and just look ahead and make sure that we're covering everything and get all the input. And he certainly did that well. So I know that the budget was sent out. Everyone, if really, as of Monday, I had not heard that anybody had comments for additions or differences. But Jason, you can fill us in.
Yeah, so same thing as the work plan. We sent it out last week. met with several board members. There were no additions or changes to the budget as from what it was originally presented. So what was sent out last week remains the same and what is now in the meeting packet.
Okay. I would like a motion to approve the FY 2022 budget as right, it's in process. And by approving this today, I'm asking you, Jason, this will be our final, we're going to be sending this on to the finance committee of the county board. Is this correct for approval or?
I believe that's the appropriate body to submit it to, but maybe Tim could clarify on that.
Yeah, that would be helpful.
Yeah, that's exactly who you send it to, the finance committee.
Thank you. So I would need a motion for this budget to be approved.
So moved.
Okay, thank you, Linda. I need a second. Dick Cooner, thank you very much. Any further questions, discussions?
Marianne,
Yes, Bill.
hopefully this isn't too far of a digression, but Jason and I met last week and spent a lot of time around the, if I could just expand on that discussion a little bit, the $50,000 line item for system coordination, and he referenced it earlier. I just found that to be an incredible opportunity as he and I talked about it more. He also reflected that he's researched, as he normally does in his very thorough manner, other mental health board entities that have significant dollars in their budget for system coordination. And it just struck me as he and I talked about it, what an opportunity for our board to figure out how to be the maybe single front-facing entity to the community that helps coordinate services among providers. Because really, there isn't any one, I hate to say one-stop shopping, it seems to be to minimize the concept, but there doesn't seem to be that right now where a single source could direct people in need to resources that may already be present. So I just wanted to emphasize that if questions come up once it gets to the county board. Very honestly, as I said to Jason, if that idea fully evolves, that's probably not enough money for that item.
I was going to say it's probably a drop in the bucket to begin with, but I endorse the concept 100%. And, you know, we did have the first meeting of all the newly funded agencies, and there was 100% participation. So I will tell you that Jason and I and Dick during our weekly meetings have discussed this whole concept of, you know, the value in us making sure that each funded agency knows the resources that are being provided by the other funded agencies. So, you know, we've really kind of just tossed around some ideas that are simple as meeting in different places for the network meeting. So, you know, the sponsored program can kind of do a show and tell for all of the other agencies. And, you know, working in mental health for 41 years as I have, and Wendy Larson working at the state's attorney's office as many years as she didn't even really know about Rosecrans Triage Center because, you know, it just happens in those that need to take part in it or have to use the service, they know, but all the really valuable referral sources don't always know exactly what's going on. And so many people that could benefit don't even get referred. So I think you're right on, because these are really the gaps in our, you know, the whole system of care. They exist even with all the funded programs, the new funded programs, because they don't know enough about the new, you know, they've heard a little bit about them, but they don't really know how they work and how they can make referrals. So I think it's really important.
And Marion, I have to underscore that last week I took some interns over to the jail for a tour. And Cap Nowens, who basically runs the day-to-day operations of the jail, I was talking to them about this idea of the warm handoff. And I left feeling like he also was a little unsure about how that was going to look and work. And it would be so useful to have an individual who is like the central touch point, you know, for all the agencies and all the organizations that are offering services. I think it's awesome. It's almost like a communication officer, if you will, so that people know who to call to get an answer. Yeah, I think it's a great idea.
So, yeah, I agree. And you know, this is our first year, but I agree that as this grows, I think the need for, you know, this, should I call them a facilitator or a collaborator, specialist, or a resource? I don't know what we call it, but yeah, Dick.
Yeah, while we have Joan Lodge in the room, I would like to ask her about this because she's part of what used to be the homeless task force. And she's been doing that for a long time. And then also, you know, been part of this previous system. So Joni, can you fill us in what is current in terms of, you know, what forums are available that spread good information about what various agencies are doing?
Oh, Jason's on mute.
Yeah.
So when this was actually brought up, that's actually the first thing that came to mind was the Homeless Coalition. Because what the Homeless Coalition realized is that very much like the Family Peace Center did, you know, you have to go here and you have to go there and you have to tell your story. It can be very, you know, burdensome. So what the Homeless Coalition did is what almost like a strategic plan to do that single point of entry for homelessness. And really, so what that did was anyone who was homeless or at risk of homeless, experiencing homelessness, that was their central point where they had to go. And then they went through a screening process and they used an evidence-based tool called the VI SPDAT. And that determined on base of some criteria of how you rated, like, you know, pretty acute or, you know, severe. And then that also determined what agency you get referred to. So that was a great model. Then we used consultants to pull that all off, but it also helped just so everyone also was treated fairly. And so not jumping the queue, so to speak. So did that help?
Yeah,
Yeah,
for sure.
that's good information.
Well,
Okay.
Marianne,
Yeah, yes, that.
I just want to point out that some people already think we're trying to do this. So I think it would behoove us. And the reason I say that is based on some of the questions we got when we were at the county board meeting.
Right.
It seemed like, and again, I can't speak for what the general population is thinking, but those who were on the board were asking questions as if this was what we were already doing.
Well, they got really specific about what phone number do you call? And, you know, I thought Jason really explained it very, very, very well that in, you know, in terms of a psychiatric crisis versus just trying to seek care, and, you know, certainly explain the two different ways to go about that. And I thought that got the point across, but I mean, right now, we're not in a position to have people call the mental health board 24 hours a day to say, what program should I go to? But what we can and we have done is let them know if it's an acute emergency, what number and how they can get immediate services, definitely through the co-responder program right now. That's for the crisis. You know, if they have somebody that's in need of immediate intervention, 24/7. Yeah, Dick.
Well, futuristically, I mean, what we're really talking about is something that we can put in and plan for in the next fiscal year in 2022, because we're talking about access to service. And so let's look at community models that we might come up with that would answer this question, because we're obviously going to have expanded monies to do those sorts of things. So let's, you know, so that's really what this is sort of saying to us, I think. And that is, hey, here's a priority for service that we need to address.
Yeah, and if I can just, Marianne, add, you know, that's why Jason and we had our discussion, and he put that intentionally into the work plan to have an expanded discussion about, at least in this first year with, as you noted, relatively minimal amount of dollars, how would the board begin? And Joan mentioned, I even said to Jason, I was thinking of the Family Peace Center for mental health. You know, where do you have that? Not that it's necessarily a facility or a person, but at some point in the future, could it be something relatively robust where we do function as that facilitator and navigator in some way? But that's why he put it in the work plan, to be intentional about.
Yeah, and I think we have a lot of good exploration to be doing. And because right now, what we want to make sure of is that each provider does not look at just their program in a silo, that they look at the program as a connection to the other programs that have been funded as well. That's when the system of care really develops.
So where does 211 fit into this?
Well, that was something that I mean, that's part of the discussion, and that's a little bit, yeah, I can't specifically say, but right now, you know, in terms of just getting, depending on the need of whatever the person is calling for, and it isn't always mental health. And we fund mental health and substance abuse. I mean, we're not trying to take on the contact role. Or yes, and we don't want to take on the 211 role. That's not how we want our funds to be used. We want to be able to help those in psychiatric and substance abuse crisis, or to seek care in the community, and to have, and what we did this year is increase access and to let them know all the new access points to seek treatment. I mean, there was a lot of new ones. So,
Marianne, if I could just follow up on what you said, because I think that's an important distinction, that this is not indicating that nobody's doing this work. There are you know, agencies that coordinate services with one another. I think, you know, Danielle, who is humble enough not to toot her own horn on the meeting, NAMI does a lot of coordination for individuals and families, helping them to connect to resources. So I think this is about finding the areas that we have gaps in our community as it relates to systems coordination, and the things which we are uniquely positioned to address as a funder and a county mental health board.
I agree.
So,
Okay, so we'll get back to, we do have the motion to approve and a second, the 2022 budget. Any further discussion? Hearing none, all those in favor, please, and say aye. And Marianne, aye.
Aye.
Dick Kunert,
Aye.
Dr. Copeland,
Aye.
thank you. Danielle Angelari,
Aye.
Dr. Bill Gorski,
aye.
Dr. Terry Giardini, Tim Neighbors,
Aye.
and Linda Sandquist.
Aye.
Okay, so moving now into our last action item. This is regarding new board member appointment recommendations to the county board chair. And I'm going to let Jason take this because he has the totals of all of the tally, I should say, of all the board members. There were 5 of us that evaluated the application. So Jason?
Sure, Marianne, just I guess to reiterate the process, we had a board application. Sorry, let me pull up the date so I can just be very specific. A board application that opened on June 29th was open for 3 full weeks. During that time, there were multiple pushes that were made, including an email that went out to everyone that's signed up for the email updates, and a Facebook boost of $100 that reached over 7,000 Winnebago County residents. So it was well distributed. We found from the email push that there were many opens, more opens than the amount of people we sent it to, because some of the people that received it were forwarding it to their network. So it appears to have been widely distributed through both of those platforms. We ended up receiving a total of 14 applications. I'll just say upon my review, I thought they were all very good applications, but going through the matrix, again, there were 5 board members who did a deeper dive into reviewing all of these and according to the criteria the board established and developing their top choices. So each board member that reviewed them, I met with them individually. Everybody came up with at least 2, if not 3, in some cases 3 of their top choices. And from that process, the top 2 overall choices were Wendy Larson Bennett and Jeanette Towns, and they were equally ranked as the top 2 choices. So a letter was drafted to Chairman Shirelli recommending that one of those 2 candidates be chosen as the new appointment for the board. And with that will be attached their applications that were provided to the board.
Yeah, and just to expand the discussion somewhat, it's really been very helpful, given that Wendy has been on the board long enough and been an advisor long enough that when that position of Wendy were chosen to be the board member, then we have an open advisory member, and we feel that it would be very apropos for then the other candidate to fill and to be offered that advisory position, because it's a wonderful way of getting to know the board, and then also really understanding, the strategic plan, the mission, the vision, and that was part of the application process, to be able to assure that their commitments were comfortably in line with what the board's goals and strategic plan is at this point in time. So I think that, with the 2 recommendations that, as we approve this, that just keeping in mind that, that would be offered. And I think, Jason, the way that the letter to Chairman Shirelli will outline this, that we would recommend, 1 person for the board and then the other person for your advisory, right?
Well, Marianne, no, the letter doesn't dictate that specifically.
Okay.
Be updated to add that. Upon my review of past appointments, and please correct me if I'm wrong because you were all involved and I was not, but I did review past board meeting minutes and things of that nature. And I do not believe the advisors were actually appointed by the chairman. I believe the advisors were appointed by the mental health board itself. So I don't know that it necessitates that the chairman appoint 1 person to be an advisor.
Actually, Jason, he did appoint our advisors the first
I
one.
see no record of that.
Yeah, it was verbally, but yeah, he did.
Okay.
He appointed everyone.
Okay.
What did you say, Pam?
I just want to say thank you. I appreciate your vote of confidence, but I also find myself in a kind of awkward position because I reached out to Jeanette, who is someone I have gotten to know through the referendum. She and I would go out to the community and present, and I think she's an amazing individual and brings a lot to the table that would be of use to the board, regardless of whether she's a voting member or a board member. So however you choose to do this and however the chairman chooses, I hope Jeanette is part of the mix, because I think she has a lot of experience and insight. So.
Well, actually, the board felt that way. The majority, both yourself and Jeanette were the highest vote getters, as you might say, because of the experience and whatever. So, yes, I think we were all convinced of that. So, okay.
So Mary Ann, maybe we should clarify then, if we are going to accept the letter as is, in which case we're simply making a recommendation that one of two individuals be appointed to the board, or if we would like to add to that should the current advisor be appointed to the board, that we're also asking for the other candidate to be appointed as an advisor.
I mean, that I'd like to hear others' opinions on that. That's what I thought would be.
I'm in favor of that.
I think it's appropriate.
Anybody else have any other feelings regarding this issue, or thoughts or suggestions? Okay.
Jeanette and I are kind of cousins. That isn't a problem.
No.
Is it?
Yeah. No, I mean, I feel at this point, I should ask Jason, is that anywhere, in any of the Community Mental Health Act in terms of board members that, I haven't.
Well, Community Mental Health Act, neither the Community Mental Health Act nor the Public Officials Act really dictates this type of position of advisor.
Okay.
So I wouldn't be aware of any type of statutory regulation around the advisor's relationship to a board member, since advisors are not really addressed at all. But I'm happy to ask legal counsel. Probably the best I can do, other than offering my layman's.
I can't imagine.
Yeah. Okay, so I will need a motion for the new board member appointment recommendation to the county board chairman. So I'm looking for someone.
So moved.
Mary, okay.
But any more discussion, Bill?
I'm sorry, I don't know that you had a second. I'll second for the purpose of discussion.
Okay, I thought I heard, but go ahead, that's fine.
I wondered if we were going to pivot back to Jason's point to re-edit the letter with the clarifying issues regarding the advisor position, between Wendy and Jeanette, somehow wordsmithing that. It seemed like we were heading in that direction.
That's what I thought Jason said at the end. So maybe I'm jumping to a conclusion. Jason?
Yeah, I just think that maybe what Dr. Gorski's suggesting is that the motion need to be to accept the new board member appointment recommendation to the county board chairman, with the addition of a paragraph that states, should Wendy Larson Bennett be appointed to the mental health board, that Jeanette Towns would then be recommended to be appointed as an advisor.
Perfect.
That's great. So
That was my understanding of the motion.
Okay, very good. So
Good.
So the motion is edited with the wording that Jason just reviewed. And the second, Bill, you did second the motion with the editing as well.
Yep.
Okay.
Yeah.
So any other comments, discussion? Hearing none. I'll take roll call. All those in favor say aye. Marianne just did. Dick Cooner,
Aye.
Dr. Ed Copeland,
Aye.
Danielle Angelari,
Aye.
Dr. Bill Gorski,
Aye.
Dr. Terry Giardini, Tim Neighbors,
Yes.
and Linda Sandquist.
Yes.
All right, very good. That's our action items. So the next two are basically discussion items. There is it's in our bylaws. Is that correct, Jason, that we have to have an election of officers every year?
Yes, that's correct. The bylaws dictate election of officers at the September meeting, except for the first year, I believe you did it earlier than that and allowed for more than 1 year until the following year, September. An additional change that will likely take place for next year would be with Senate Bill 2278 now sitting on the governor's desk, having passed both the House and Senate unanimously. Should that be signed and go into effect, it will then connect the mental health sales tax legislation directly to the Illinois Community Mental Health Act and dictate that this board function as a mental health board per the Community Mental Health Act. And the Illinois Community Mental Health Act actually dictates election of officers in July. So I'm saying this with the caveat that we would do the election in September this year and likely next year be doing it in July so that the term for this year would perhaps not be a full 12 months.
Okay, so in terms of the process, I know that we would vote on the slate in September. But for board members that feel that they want to step up and assume, whatever office they so choose, how should board members go about this? Do you know that, Jason, how that should work?
I think that the rules of order would dictate a nomination be made, any nominations be taken, and then a board vote. But I can clarify that before the September meeting to.
Okay, so would that take place at the meeting itself?
Yes, at the meeting itself.
Okay. So if people, want to think about it, go ahead, Linda.
Yeah, I just had a question. Are there any limits on how many terms as an officer someone can serve?
I've not seen, do you know, Jason? It's every year. And it doesn't mean that those of us that are officers right now have to resign and someone new has to take it over. I
know that other mental health boards have referentially, when we've been talking with them, I think, Marianne, you might recall, we met with a member from somewhere southern that mentioned that his board president had been the board president for more than 20 years. So I don't think that specific restriction exists in the Illinois Community Mental Health Act.
Yeah.
We'd be so lucky to have Marianne serve for 20 years. I will double check the mental health board's bylaws, but I don't recall there being a term limit in the bylaws either.
Okay. And then I have one other just comment, a general comment about this. I feel that it is, this has been a learning year for sure. And, for those of us that have assumed these positions, I know for myself, I would be willing to stay on. And Ed has been learning, what the county needs and how to get our bills paid. And really, we're just finally at the point of figuring all of that out. So I do think we should take that into consideration. Not that I'm trying to say, oh, please, understand. And Dick has been, it's been a year of, really just I don't want to say experimentation, but, we've learned a lot. And so that's all I'm saying, that going forward, every year, putting new people in, we should think about it in terms of terms. It's hard to really complete a job in a year. That's all I can say.
All I can say, don't worry about me being around for 20 years.
Oh, Dick,
Methuselah.
you'll outlive every one of us. Are you kidding me?
You know what? What you might consider is have the executive board, maybe with help of other board members, write sort of procedure manuals for the fiscal year, so that next year when there's a transfer, if there's a transfer, there's sort of I've been there, I know how to do it, this is what you should expect, so that we don't get, I think everyone on the executive board has been amazing, but we need to anticipate in the future changes, and they shouldn't have to reinvent the wheel. So just food for thought.
Yeah.
For the future.
And I think another factor, and maybe Tim can comment on this as well, the county board is just beginning to know names to begin with. So relationships really have not been fully established at this point. So we should recognize that fact too. That's very important, that they gain confidence not only in the board, but they have a relationship with individuals. So, trust is built that way. So that's all I'm, throwing out from my bird's eye view. But I will tell you, I will not, if somebody else wants to do it, I'm 100% supportive, and I'd help in any way I could. So,
Just, Mary Ann, if I could, well, it's not an action item on the agenda. We're going to do that.
No, it is not.
Yeah. But I just think, and I've been, and maybe others of you have seen boards, that I think it's a mistake to have extremely short terms for the leadership of boards. It's 2 years is an absolute minimum, in my opinion. And in some circumstances, this could be one where it's even more than that. I think that you said it very eloquently. We're new, relationships are being formed. I just personally think changing that right now would be a mistake. So that's my 2 cents.
Well, thank you for that input. I think, everybody should consider what they want to do. And if they have, a different vision on this, I mean, that's why we're doing this, and it's good to discuss. So the one good thing I can say, we're not changing Jason. So whoever.
Well, it does make me think of one other thing. Jason, were we all appointed to this board by possibly Chairman Haney at the time with certain terms?
Yes.
There are 3 expiring terms that would come up at the end of January.
Mm-hmm.
So we have to be looking at that and how we deal with that, or re-up, or whatever we.
Right. And it can be as simple as that.
Okay.
If interest remains with the individuals, the terms are up, they can renew without. And do we need the blessing of the chairman for renewal? I guess would be my question.
I would believe so, yes.
Absolutely.
Okay.
Okay, great.
Very good. So a lot to think about for September. And the next, unless there's any other discussion on that agenda item. Okay, then moving on, we did begin the hybrid board meetings and kind of explored that a little bit. Does anyone have any more to say about that? No. Okay. So we know Jason is going to be looking into it and will give us feedback ASAP, so we can all understand. Because if we have to develop our own policy, then we can have that as an action item in September as well. So, all righty.
I move for adjournment.
Wait, before the adjournment, there's other matters. Okay, I don't want to forget this because yesterday was a year anniversary for Jason Holcomb as our great leader. And I just wanted to congratulate him for a job well done for the year and give other board members opportunity to let him know, how much we have appreciated. I mean, he has done things that are really, it's amazing to me every week when I talk to him. I mean, he's got things going on that in talk about juggling act, the balls in the air, he manages beautifully. So Jason, we appreciate you very much and congrats.
We're here.
Thank you, Jason.
Thank you, Jason.
Thank you all, and since it has been a full year, if anybody wants to run for my position, I'm elected for that.
We won't allow it. I'm sorry.
Yeah, you're in for a while, buddy.
Lifetime appointment.
Yeah,
Let me tell you.
correct,
Yeah.
correct.
Yeah. So, okay. So then the following is Dick, you're
Yeah, why don't we I make a motion for adjournment?
okay. Any second?
Second.
Oh, good, Ed. All right, roll call. Mary Ann, aye. Next is Dick.
Aye.
Ed Copeland,
Aye.
Danielle Angelari,
Aye.
Dr. Bill Gorski,
Aye.
Dr. Terry Giardini, Tim Neighbors. Tim, are you with us?
Yes. Aye.
Aye, okay. And Linda Sanchez.
Yes.
All righty.
All
Well,
right.
thank you all for a great meeting and for all your input. And
Thanks,
we will
everybody.
see you.
Thanks again, Jason.
Thanks
Thank
a
you.
lot.
Bye-bye.
Thanks for
Bye,
coming, Joni.
Okay.
Bye.
Yeah, take care.
Okay.